Hello everyone and welcome to our poster presentation, Promoting Social Engagement to Improve Quality of Life in Older Adults. My name is Emily.
Ivan.
And Nathaniel. The global population of older adults is increasing. It is estimated that the percentage of older adults over the age of 60 years will increase up to 22% by the year 2050, as projected by the World Health Organization, and as such, services provided by long-term care facilities are projected to increase as well. Older adults in long-term care facilities are more vulnerable to social isolation, which can lead to negative effects like depression, frailty, and sleep dysfunction. It will be important to ensure that the quality of life in this population is maintained in the decades to come.
Our group developed the following PICO question. In people aged 65 years and older in long-term care facilities, does targeted social engagement when compared to social isolation positively improve quality of life?
The other database used was Google Scholar. Additional key terms include attitude to life, elderly, geriatric depression scale, inclusion, life purpose, life satisfaction, nursing role, psychometric, social interaction, and wellness. Other limiter use include full tests and peer review.
And now for our data extraction. To support the group's proposed study, I conducted an integrative review to determine an appropriate measure of quality of life. Results showed that there were several quality of life assessment tools at researchers' disposal. The most commonly used QOL assessment tools worldwide included the CAPS-16, CDC HR QOL 4 and 14, the EQ5D, EQVAS, the SF36, and the SF12. However, specifically engineered QOL tools were also identified, such as the Adult Social Care Outcomes Toolkit, otherwise known as the ASCOT, and a self-rated analog scale for successful aging developed by Singaporean researchers in 2014. The quality of life assessment tool that provides the most valid and reliable data and fit for our proposed study is the WHOQUAL Brief. The WHOQUAL Brief is an abbreviated version of the WHOQUAL 100, which was developed by the World Health Organization's Quality of Life Group in 1994. It is comprised of 24 holistic facets universally regarded by researchers as important for assessing quality of life. Facets include a person's physical, psychological, social, and spiritual well-being, while also including a facet on an individual's activities, making it a desirable tool for our study. The WHOQUAL Brief's domain scores correlated to around 0.9 when compared with domain scores of the WHOQUAL 100, demonstrating good criterion validity. They have also shown to display good discriminative validity, content validity, and test-retest reliability. The culmination of all these factors makes the use of the WHOQUAL Brief the ideal tool for the proposed study.
The integrative review I conducted for our research revealed the studies were congruent with one another. The most common theme is older adults who participate in social engagement are projected to have a healthier standard of living. The primary interventions include age-appropriate activities, which are enjoyable and inclusive of older adults' daily routine. A few examples include exercise activities, interpersonal socialization between other nursing home residents, live visual interaction via technology with family members, and community programs targeted for older adults.
For my portion of the project, I conducted an integrative review to examine the intervention that targets social isolation among the older adults. The 5 qualitative studies conclude that older adults should be encouraged to interact with other human beings to reduce the social isolation and improve their quality of life. Because of this contribution of this qualitative study, future research will have a better understanding of many integral emerging themes among the older adults and necessary basic information to create a higher level research. The qualitative studies are level 6 of evidence, and they contain a small sample size, although the rigor is maintained in this situation with the triangulation technique. There were numerous measurement tools used during these studies, including a structured questionnaire, semi-structured interview, focus group guide, friendship scale, the USA loneliness scale. The tool the most important was the USA loneliness scale, which was the most reliable measurement tool with a high Cronbach alpha coefficient of 0.9. There were numerous measurement tools used with this study, including a structured questionnaire, semi-structured interview, focus group guide, friendship scale, the UCLA loneliness scale, which was the most important reliable measurement tool with a high Cronbach alpha coefficient of 0.9. The 5 studies employ different interventions to tackle social isolation in older adults, but in the end, all of them they had in common the purpose of promoting social interaction. As an example, it would be the choose to move, the physical activity, the school of age of all the people, they come to eat together, and other significant will be like fostering more significant contact with relatives. Despite the finding of this review, there is an overall lack of research in the broader area of social isolation. It was also noted that the limitation that exists in this quasi-experimental study included lack of participant, accessibility to community resources, and disparity in gender, where there were more females than male participants.
Now we will talk about some implications in the realm of nursing. The WHO Call Brief is an effective, concise, yet holistic measure of QOL that nurse researchers can use for large-scale population-based studies.
The implications to nursing care include promoting older adult participation in social engagement as a holistic intervention for increasing their overall quality of life. Limitations for the study were exclusive of older adults with chronic illnesses, decreased cognitive ability, English-speaking participants, in addition to low level of evidence for this research topic.
And our goal is to understand the implementation of a community intervention to decrease the present and future comorbidities, increase the peer relationship of the older adults, and improve the quality of life for older adults.